When it comes to men's health, there's one silent issue that often creeps in with age, and yet very few people talk about it openly. I'm talking about the prostate. For many men, the prostate works quietly in the background during their younger years, hardly noticed at all. But as time passes, this small gland often begins to grow. And when it does, it can cause one of the most frustrating and uncomfortable symptoms of aging, difficulty urinating. Now here's a surprising truth. An enlarged prostate isn't rare at all. In fact, by the time men reach their 60s, more than half will experience it. And by age 80, that number climbs even higher. Yet so many suffer in silence, thinking it's just something they have to live with. But here's the good news. Modern medicine has developed several different ways to address this problem. And in today's video, we'll explore the most common treatments, their pros and cons, and finally, a newer, minimally invasive method that offers real hope for men who want lasting relief without the pain and long recovery of traditional procedures. If you're interested in healthy aging, vitality, circulation, or just learning about safe, natural remedies that can improve life as we grow older, you're in the right place. And before we dive deeper, make sure you subscribe to Calm Health Hub for more science-backed health insights designed to help you boost energy, protect brain health, and support longevity for both men and women. So let's begin with the basics. When the prostate is its normal size, urine flows easily from the bladder through the urethra. Think of it like water moving through a garden hose with no bends or blockages, smooth and steady. But as the prostate grows larger with age, it begins to press against the urethra, narrowing that pathway. Suddenly, something that used to be automatic, like urination, feels difficult, slow, and incomplete. Have you ever noticed how frustrating it can be when water pressure is low in your shower? That's exactly what men describe when dealing with an enlarged prostate. The flow is weak, it takes longer, and sometimes it feels like it never really finishes. Doctors call this condition benign prostatic hyperplasia, or BPH. The word benign is important here. It means it isn't cancer. But even though it's not life-threatening, it can seriously affect quality of life. Imagine waking up multiple times at night just to use the bathroom, struggling with discomfort, or even worrying about accidents when away from home. That stress can impact sleep, mental wellness, and overall vitality. So, what can be done about it? Traditionally, doctors have turned to medical procedures that physically open up the urethra by moving or removing parts of the prostate. Let's look at a few of the most common ones. One option is the stapling procedure. In this method, tiny staples are placed inside the prostate through the urethra. These staples act like miniature curtain holders, pulling back the extra prostate tissue that's blocking the passage and creating a larger opening for urine to flow through. It sounds clever and it can provide relief, but there are drawbacks. Over time, the prostate tissue may continue to grow, eventually blocking the urethra again. And in some cases, the staples themselves may shift or even break down, requiring another procedure. Another method is called green light laser treatment. Here, a thin telescope is inserted through the urethra, and a laser beam is used to vaporize the overgrown prostate tissue. It's a bit like using high-power light energy to burn away the blockage. While effective in the short term, there are disadvantages here too. Scarring, burns, and the possibility of tissue growing back mean it's not always a permanent fix. And with both stapling and laser treatment, men often can't urinate on their own right away. The procedure causes inflammation, so a catheter, a small tube, has to be inserted to allow urine to pass while the body recovers. For many men, this process is uncomfortable, inconvenient, and emotionally draining. Have you ever had to deal with even a short-term medical device that limited your freedom? Imagine living with that for days or even weeks. It's not surprising that men often hesitate to go through with these treatments, even when they know they need relief. This brings us to an exciting, more modern approach that is changing the way doctors treat enlarged prostates. It's called prostate artery embolization. Instead of going through the urethra, this method works from the inside out by cutting off the blood supply to the overgrown prostate tissue. Here's how it works. A doctor makes a very small incision, usually in the groin area, to access an artery. Through this artery, a catheter is carefully guided all the way to the vessels that feed the prostate. Once in position, The doctor releases tiny beads that block those blood vessels. With the blood supply reduced, the prostate gradually shrinks back toward a more normal size. And when that happens, the urethra is no longer squeezed, which means urination becomes easier again, often without the pain, scarring, or long recovery time of older methods. This technique is less invasive, has fewer complications, and patients often recover much more quickly. Imagine solving a problem at the root, instead of constantly trimming away the overgrowth. That's essentially what embolization does. Let's pause here for a quick recap. We started with why the prostate causes trouble as men age. We explored stapling and laser procedures, including their benefits and drawbacks. And now, we've introduced a modern option that targets the root of the problem. So far, what do you think? Would you consider a newer, less invasive option like embolization? Or do you feel more comfortable with traditional approaches? Let me know in the comments. I'd love to hear your perspective. And if you haven't already, this is a great time to subscribe to Calm Health Hub so you never miss upcoming videos on natural remedies, circulation, boosting energy, and maintaining healthy aging for both men and women. Now, you might be wondering, are there natural ways to support prostate health alongside medical treatments? The answer is yes. While procedures are often necessary for moderate to severe cases, lifestyle changes and supplements can also play a valuable role. For example, maintaining a healthy weight, exercising regularly, and eating foods rich in antioxidants can all help. Tomatoes, berries, green tea, and nuts provide nutrients that support prostate and overall men's health. Certain supplements, such as saw palmetto, beta-sitosterol, and zinc, have been studied for their ability to ease urinary symptoms. While results vary, many men report improved comfort and flow when combining these natural remedies with professional guidance. Of course, always check with your healthcare provider before starting any supplement. What works for one person may not be suitable for another. It's also worth noting that stress management plays a big role. Anxiety can worsen urinary symptoms, while calm breathing exercises, meditation, and good sleep can improve bladder control. Remember, healthy aging isn't just about the physical body. It's also about mental wellness, resilience, and vitality. So as we near the end of today's discussion, let's do one final recap. Enlarged prostate, or BPH, is incredibly common as men age. Traditional treatments like stapling and green light laser can bring relief but often come with discomfort, risks, and the possibility of recurrence. Modern embolization procedures, on the other hand, offer a less invasive alternative that shrinks the prostate by reducing its blood supply. And for those interested in natural remedies, diet, supplements, and lifestyle choices can provide valuable support. If you found this video helpful, make sure to subscribe to Calm Health Hub. By joining our community, you'll get access to practical, calming, and science-based strategies for maintaining longevity, circulation, brain health, and vitality, no matter your age. Thank you for spending this time with me today. Remember, knowledge is power, and when it comes to your health, you deserve to feel informed and supported.